All right, everyone, I want to welcome you to a special Wednesday night faith formation trilogy of nights. Tonight is the first of 3 events where we are featuring some of our mission partners. So some of you know this, that First Presbyterian Church of Flint is purposefully partnered with organizations across the city of Flint doing work that we otherwise could not do on our own. And through our financial partnership or our partnership with volunteers, we are able to expand the ministries that we are able to touch. And so tonight we have 3 exciting guests representing 3 exciting ministries. So I'm going to introduce them to you. And then what we're going to do is we're actually going to record our conversation here tonight for those who can't be here. So we'll have a record of it. But we're going to have just a roundtable conversation about ministry in Flint, of what the needs are in their organizations. If you have questions about their particular organization, save them to the end. And we'll get to hear some exciting things going on in their ministry. So I'm going to start this thing over here, and then we'll start our introductions. All right. Up first, we have Dr. Chris Townsend, who serves as the Executive Director of Carriage Town Ministries, stepping into the role at the start of 2024. Before joining Carriage Town, he spent more than 7 years at the Detroit Rescue Mission, where he held leadership positions including case manager, program manager, and building director. He later served as regional manager for the Salvation Army's Emergency Shelter Program. He and his wife, Nina, are proud parents of 2 sons, Christopher and Isaac. Still proud? Yes. All right, good. Well, that's a good man. Carriage Town Ministries, Dr. Townsend leads a Christ-centered mission that's been serving Flint since 1950, providing food, shelter, education, and faith-based support to those experiencing homelessness. Through a variety of programs, the ministry works to share help, hope, and the transforming love of Christ throughout Flint and Genesee County. Could we welcome Dr. Chris Townsend tonight? To his right, your left, is Stacey Doyle, who serves as the Executive Director of the Genesee County Free Medical Clinic. With more than 20 years of experience working in Genesee County, she has built strong partnerships with healthcare and nonprofit leaders to expand access to medical care and education for underserved populations. Stacey has also developed best practices in coaching uninsured and underserved patients, helping them navigate community resources and manage their own health outcomes. She continues to lead the clinic with a focus on compassion, collaboration, and empowering every patient to achieve better health. The Genesee County Free Medical Clinic, located here in Flint, is a community-based nonprofit that provides free medical care to uninsured adults throughout Genesee County. Staffed by volunteer doctors, nurses, and community members, the clinic offers primary care, diagnostics, and prescriptions at no cost to patients. Since opening its doors, the clinic has become a vital resource for those who fall through the gaps in our healthcare system. People who work hard but can't afford insurance or access regular medical services. Supported entirely by donations, grants, and local partnerships, the clinic embodies a true community that cares, offering hope, compassion, and healing to those who need it most. Can we welcome Stacey Doyle tonight? And lastly, Matthew Soulia, who serves as the founder and executive director of Forge Flint, a community-developed nonprofit rooted in Flint since its founding in 2012. Matt brings experience from refugee resettlement, pastoral ministry, and community development. He currently works in workforce and economic development at Mott Community College. He holds a master's in global leadership from Fuller Theological Seminary, go Fuller, and a bachelor's in religion from Olivet Nazarene University. Through Forge Flint, he continues his lifelong commitment to supporting his hometown by building bridges between church, community, and opportunity. Forge Flint is a Flint-based nonprofit organization that focuses on holistic community development, applying Christian principles in action through service, connection, and collaboration. Their signature initiative, the Forge Garage, works with partner agencies and churches to provide equitable auto repair access for low-income families, removing transportation barriers that impede work, school, and stability. Forge Flint also mobilizes volunteer teams from across the country to engage in home repairs, beautification projects, and other serve trip efforts, weaving together neighborhood renewal with opportunity and hope. Can we welcome Mr. Matthew Soulia? All right, I think do our microphones work okay? Can you just bring them close to your, yes?
Yes.
Yeah.
Hello.
Can everyone hear okay? Yeah. Yes?
Can you hear me?
Well, I haven't said anything yet, that's
Testing,
right. Okay.
Testing.
All right, here's what I'd like to do, and I'll start kind of in the reverse order that I went. So we'll go Matt, then Stacey, then Dr. Townsend. If you could give us a day in the life of an average client or patient or resident, what is, like, how did they come to find you? How do you work to serve them? What's sort of a day in the life for them?
Yeah, so I'd say many of our clients typically are folks who are working very hard to make ends meet. Generally, they're working in manufacturing, or they're working as a CNA, or in a position where they are doing everything they can to provide for their families, but need a little bit of extra support, especially around being able to get to and from work. And so that's where the garage kind of steps in. We have a lot of different referring partners, and First Pres has been really a pillar, foundational partner since the beginning of Forge more than 12 years ago. Lisa in the back is one of our board members, also a huge member of our team in terms of working with a lot of the clients who are coming, maybe who aren't coming directly from a referring agency, but through word of mouth, they hear about the garage, and we can send them to her to be able to connect the dots for us. So they get a referral, and then they will bring their car by the shop. We'll be able to take a look at it, see what's going on with it, assess the situation, and then be able to provide those services in a way that they can afford. So basically, we just charge the cost of the parts, which is usually about 85 to 90% discount from what you would pay at a standard shop.
That's excellent.
Yeah.
Thanks, Matt. Stacey, how about the clinic? How does the average patient find their way to you?
Oh boy, multiple ways. Our partnership with First Presbyterian is one way. Thank you. All the partnerships in Genesee County are one way that we get patients that come to us. A patient can look like somebody who maybe just lost their job. Maybe they're part-time and they can't afford insurance. They might have a change in marital status, or they may be a newcomer to the state. And when they walk in the doors, our goal is to become their new temporary primary care health family. And we just want to give them that boost to prioritize their health first, and then they can take care of the rest of their families. If we provide that care for them, then they can extend that and change the position that their family's in right now too. So it's a start of a relationship. So they get free care, free prescriptions, and some of the diagnostic things you mentioned in the introduction.
Excellent. Okay, how about you, Dr. Townsend? People coming to Carriage Town, how do they find their way to Carriage Town, and how do you help serve?
Well, folks at Carriage Town, they find themselves there several different ways. They could get a referral from a community partner. They could get a referral from the HARA, which is the Housing Assessment and Resource Agency, or they could just find us on their own. Oftentimes, folks are coming to us in crisis, and we serve primarily, really all of our residents are homeless. So we're finding folks in crisis, in the middle of a crisis. So when they come to us, we're trying to deal with that initial need that they have, is just to make sure that they have a safe place to stay, structured environment, and then they can start thinking about some of the other things that they may need to address, if it's food, clothing, healthcare, many of which we partner with some of our folks here. So Matt and Stacey, so we may see some of the same folks, or be referring partners to each other. So I think the biggest thing for us is just to make sure that people can kind of start over somewhere, but also a big component of what we do at Carriage Town Ministries is providing the gospel. We believe that a big part of helping people transform in the way that they would like to, and we're just guiding them along that way, is to have a relationship with Jesus Christ. So our church partners help a lot with chapel services, and the hopes is that they will, once they leave or in the middle of the programming, they'll have an opportunity to connect with the church, and then once their programming is over, say they move to a positive housing destination, they will continue that relationship with one of the church partners that they've they've built while they're on campus. So they find themselves in a precarious situation when they come to Carriage Town Ministries, but the hope is we can provide a level price, a little family environment, atmosphere, by also providing a little bit of structure at the same time with some dynamic programming.
How many people might you work with annually at Carriage Town?
So annually, last year we did about 630 people.
Okay.
But that's around 40,000 and 70 bed nights. So we consider a bed night a shelter stay.
Okay.
So that would be considered a bed night. So the year prior we did about 1,130 people. But what's happening is that people are staying with us longer. So we actually did more bed nights with less people.
Interesting. Okay.
Than we did in 2023.
Okay, and Stacey, how about the clinic? How many patients might you serve in a given year?
Oh boy, with the high demand for medications, we have a lot of meds-only patients.
Okay.
So we have a little over 6,000 unique visits in a year if you
Wow.
count medication-only patients and that.
Okay. Okay. Matt, how many people Garage might be working with?
Yeah, we usually average around 300 families that we serve annually as far as
Okay.
offering those repairs or in terms of getting a vehicle to a family that doesn't have a car.
Yeah. Okay. When we think like, I don't know how many people here are familiar with like Maslow's hierarchy of needs, but like, it seems like a lot of what you all are addressing are really tier 1 or tier 2 needs, whether it's healthcare, transportation, food, shelter, clothing. Those are the basic ones, right? But I don't think none of you would be happy to just keep not seeing transformation in the lives of some of your families, right? So, or the people you're serving. So what does transformation look like for you, and how do you know that, like, yes, we're breaking in to the life of this particular client, patient, resident? Let's start with Matt.
Yeah, I think working with our referring agencies and partners, knowing that we're providing a piece of the puzzle to strengthen what they're doing, because we understand that sometimes we're not going to have a real long-term relationship, so to speak, with a client, because our mission is kind of specifically dedicated to that, offering those repairs that we see as a key piece to unlocking, stability and flourishing in their life. But I know of different experiences we've had with clients. Sometimes we've had returning clients where, when you get an old car that has 320,000 miles on it or something like that, and you're just kind of trying to keep it on the road because that's the only option you have. Sometimes you end up coming back, right?
Yeah.
Sometimes we've seen with some of those families how, and we've had really beautiful testimonies where you've seen almost even like a physical transformation, and we know that fundamentally that's not like solely our work, but we've played a important piece of the puzzle by unlocking that ability to get to and from work. I was thinking of a returning citizen woman we had years ago who came through, and
we define returning citizen. That's a term that we're using more and more now, but it's not necessarily a term that's in the
it'd be an individual who's been incarcerated, and she, when we first were working with her, she was working with New Life Center in Flint, and she, I think, had only been out of prison for several weeks, but she had an opportunity for work, but she needed a way to get there, and we were able to get her a vehicle. And we, were able to kind of check up on her as she would come in as a client down the road over the course of a few years, and you could see that physical transformation from, the time we first met her to, the amount of pride that she took in that vehicle.
Yeah. It
was spotless. I mean, it was incredible, the care she took for that, and then knowing that she had opportunity after opportunity that came her way, and we got to play a part of that story, which is really what it's about in that collaboration. So
I love it.
Yeah,
that's great. Transformation at the clinic. Transformation.
I could use car analogies. I could use everything. This is a great forum. Transformation. It starts with respect, trust, and I'll give you a story. Sometimes patients come in and they're very quiet and they don't know what to expect at free clinic. And by building that trust and us listening to them and them listening to us on what might be going on internally and seeing them become healthy.
Yeah.
And then seeing them talk more and more interactive. I'm going to give you one brief story. we had a clinic full of patients on a Tuesday afternoon, and they know that sometimes at the clinic they're going to wait a long time, but they're going to walk out of the clinic with all their needs met. But I had a young woman and a daughter come into the clinic, and she wanted to sell us a blood pressure cuff because she was short on money. And I said, just so you know, we may not be able to give this to another patient, but let me go back into my office and get petty cash, and we'll buy this blood pressure cuff from you. And I came back out, and everybody in the lobby had gotten out $2, $3. You know, here they couldn't afford to get care, but the patients were giving this woman money out of their pockets in the lobby, and to me that's transformation, giving back.
Absolutely.
Yeah, the empowerment to give back.
Exactly.
Yeah, love it. How do you measure transformation at Carriage Town?
A couple different ways. So so we get several grants at Carriage Town. So some of it is data driven, and then some of it is narrative. So what we hear our folks say, what's different from when they came in. Some of it is what we can see. I think the biggest transformation from a data point is if we see someone come in homeless and then they leave and they have their own housing. That's apartment, house, whatever that may be.
Yeah.
But mostly, I think for me, when I look at our residents, I can see a change in their disposition, a change in their character when they've really honed into what it is that they want to change in themselves. And so I think that transformation is a big part of setting goals at the beginning, which they would do through a service plan with their case manager, and they would create objectives and goals, and then we would help them reach that. But it's I think it's a partnership with our entire staff and our volunteers. So everyone who comes through Carriage Town, we have an opportunity to minister to each resident, so to speak. How are you doing? What did you do today? What were your goals? Did you meet them? Are you encouraged today? So even though I don't have as much contact with our residents as a case manager would, in those ways I can still speak to our residents and see how their day is going. Sometimes they'll ask me for things. It really depends on what it is. They need to get connected to a community resource. But the biggest transformation that I could see from our residents is mainly in their disposition. So you might see someone that's really downtrodden when they first come into the ministry, and now during the program and as they are exiting, they have a smile on their face. They're confident. Again, they're self-reliant. Again, they are responsible and accountable. Again, so those things are how we see transformation from my point of view. But I think if we were to ask each individual resident, they may have a different story on what transformation means to them. But I think the biggest part too is being able to infuse the love of Christ into our programming. So I think it gets to the heart issues that we all have as human beings. So I think that transformation is one of the biggest things that we can see over at the ministry.
What I love about the way you all chose to answer the question was that you didn't just say transformation is achieving these sort of metrics, right? Which I don't know about you, but sometimes the metrics are comforting because it's like, okay, I can just retreat to the numbers and say, well, we're serving this many people, we're seeing this many people. Okay, I know I'm doing good, right? But I love that we went deeper to say the particular stories, the harder things to quantify are the ways that individuals are seeing their lives change or motivated. And I appreciate hearing a little bit of that from each of you.
Absolutely.
Okay, let me ask a question that I'm not going to go all three of you. You can just decide how you want to answer this. But tell me, what's something that is often misunderstood about your ministry, your organization, your patients, your clients, your residents? What's something, or what's a myth that you wish would die?
I can start. I'll start.
No problem.
Colleagues enough.
No problem starting. Chris says no problem starting.
No problem.
3 executive directors in the room. One of you guys.
Somebody gotta start. One of us wants to talk. I think the biggest thing that a misnomer that I would want to dispel about our residents specifically is that they're lazy. We get a lot of that, unfortunately. Or that they've done something specifically to get themselves in the situation. So they bear some responsibility.
They're there by their own bad choices.
Yes, absolutely. Yeah. And sometimes it's not what people think. So some of the misnomers around homelessness are folks are lazy, this person's either a drunk or a drug addict, and that's not the case all the time. It may be part of the story for some people, but not for all. Some are just under or unemployed. As Stacey said, some may have lost their spouse, and so the income is not the same. Some may have divorced. Some may have relocated. There's so many different reasons why people become homeless, which is why it's so difficult to end homelessness, because each person has a multifaceted issue. It's not the same for everyone. There's a combination of things that brought this individual or family, unfortunately, to being homeless, and so you have to try to address some of those things. So that's probably one of the biggest things for our organization, that we have enough. That could be a misnomer for any organization.
Sure.
I'm sure that we have enough. We could always use more because costs for everything are rising right now. Food insecurity is a big deal right now across the country, but for us here in Genesee County, for sure. I know Mayor Neely has projected to start a food box program.
Yeah.
About 33% of Flint residents are on SNAP benefits.
I was stunned.
Yeah,
to
that's a really high number.
20% of our county is receiving SNAP benefits.
Yeah.
Highest, one of the highest in the state for sure.
Absolutely.
And I mean, it's a real significant issue here.
It is, and so I think just I'll give my colleagues a turn too. I apologize.
Oh, no.
Sometimes the mortar gets running. But
Feels
yeah.
like you're speaking for both of us.
Yeah.
That's good.
But yeah, absolutely. So those are a couple of the misnomers. I think for the residents, I would
Yeah.
be more concerned with those misnomers, and then for agencies, I'd say like ours and like First Pres, is that sometimes people think we have enough, and I think thankfully God has given us wisdom and good boards, and we are responsible fiduciaries over what we have, but we can always use more. So whether that's funding, whether that's your time and your talent, we can always use more of that as well. So it's not always a money issue, but it's
All of these people are ready to
All of these-
volunteer.
okay,
They're
great.
ready to sign up. Just put them to work. Just let them know where you need them. All right.
Absolutely.
Stacey, Matt, what's a myth you wish would die?
Oh, well, this myth is right in our name. We are free, but believe it or not, people still think that we cost money. We are a free medical clinic. So that's one myth, and the other myth is in our name too, Genesee County. So when I started, I used to get so upset. I'm like, in fact, we didn't have a website before I started. So I Googled Genesee County Free Medical Clinic, and it took me to the Genesee County Health Department website. So now everybody is a great partner. We have a wonderful community, starting with First Presbyterian, but now I don't get so upset about it because we all band together to take care of our underserved. But we're not a part of Genesee County Health Department, and we are free.
Okay.
And
All right.
ditto on everything else that Chris said. So
Good.
yeah.
We're just empowering our
Yes,
folks to
exactly.
speak truth now about what's
Exactly.
going on.
Yes.
Matt, what's a myth?
Yeah, I think those are great, great answers. Sometimes people get a little confused about how the process works for the garage, or because we do prioritize serving our clients who are low income. They come through that referral system, and so being able to kind of just help people understand how that works sometimes can be challenging. If we have like a news story, we tend to sometimes stay away from them because we get like a million requests that week.
Sure. Yes.
Hey, we need help, and it's
Yeah.
many. And to be honest, I think sometimes maybe this is a myth. Sometimes there's this I think assumption that people are trying to somehow work a system, so to speak, or somehow try to just take advantage of these systems.
Yeah.
We put a ton of faith and trust in our partners who send us these referrals for families, because we don't have the relationship with them often. Sometimes we do, sometimes we know them, but we put that so much trust and faith in our partners that they're sending us families that they recommend. And I'll say when we interface with them and we serve them, we get to know them, and we hear about what's happening in their lives, these families are real huge need. And I think the uniqueness with transportation in particular is we have a really good bus system in Flint for the size of the community that we have. If you have another community that has 70,000 people in a city, right? We have a decent infrastructure, but it is very limiting in terms of those opportunities. And so even in my role right now at Mott, I'm a job development specialist. I work with clients to help them find work. And often, the first question we ask, what's your transportation situation?
Yeah, how do I get there?
And if they have a car or access to a vehicle, we have a list of employers that we can potentially plug them in with. But, the majority of folks don't. And, I'd say at least 60% probably of the clients that I work with on a daily basis don't have access to a vehicle. And they're limited solely to those opportunities that are on a bus line or within walking distance of a bus stop. And so that makes it's very difficult because it very much limits those potential opportunities. And you can think about how it is if you've ever been in a job search kind of situation where you're looking for that position. It can take some time, particularly to get something that is going to be stable for you to be able to find that stability in life and not just continue to struggle. And sometimes a lot of those opportunities aren't always just right on a bus line, you know. And especially now with how expensive cars are too, right? I mean, there's those challenges there, but yeah.
Okay. All of your organizations rely on volunteers, to some degree or another, to great degree, minimal degree, but you all depend on volunteers somewhere in the chain. Who is, maybe not individually, but what is the kind of volunteer, or who are some of the unsung volunteers that really make your ministries, organizations function, that feel like maybe you get missed a little bit, in the conceiving of your organization? Does that make sense? We're looking for unsung volunteer roles.
Yeah. I'll go ahead. When you're a nonprofit, you're just so grateful to have these beautiful volunteers and it's hard not to take advantage of the big hearts and that are there. So I find that we really have to, as an organization, keep ourselves in check and take the time and express that gratitude. There's nothing better than gratitude for our volunteers. But sometimes for us, I think our pharmacists don't get the shout out that they need. The residents are part of a residency program through McLaren, and they provide great source of care and they grow personally. But our pharmacists aren't tied to a program. They just give up their time freely 3 days a week, and sometimes I think they get skimmed over a little bit, just to be honest. So
are these people who previously served as pharmacists in a full-time game? They're retired now, volunteering.
They're working.
A lot working and volunteering.
Yes, which makes it. They could be making money right now, and with the layoffs, with the Rite Aid closings and all of that, it really hit me. I'm like, these pharmacists are losing their job, and they're still giving back to our great community.
That's amazing. So,
yeah, I'd say we have some great volunteers. I mean, I mentioned Lisa earlier. I mean, she meets regularly, weekly.
She wasn't even planning on coming tonight,
right?
And now she's just getting plugged.
That's right.
She's gonna get a big head, and she's gonna be like, "Oh my gosh, like this is gonna be great."
Right. But she offers a great, an amazing resource to our team. And I was thinking we have several who are master mechanics.
Yeah.
We have a full-time mechanic named Angel, who's there every day. But then we also have.
Is that a volunteer role or a paid role?
It's a paid role.
Paid role within the organization. Okay.
Yeah. So he's a newcomer to the United States in the last couple of years. Actually, was one of my clients in my previous job.
Okay.
And day one just was like, this guy is the real deal.
He knows
his
stuff.
So it's really a special thing. But we also have several master mechanics who work full time in their own shops, but who regularly come, a Saturday, 2 Saturdays a month, they'll show up, spend sometimes longer than makes me comfortable, to be honest, there, because sometimes we'll get all the really tough, if you have trying to trace an electrical leak, for example, that can be hours and hours and hours of fiddling with it to try to figure out what the source of where that leak is happening. And those guys, they come faithfully for years on a Saturday when they're working all week and spend, sometimes 6-7 hours there on a Saturday.
Wow.
Making sure that things keep going. So I don't know how you even begin to say thank you for that kind of stuff. So,
yeah. Love it.
Yeah.
Chris?
I would agree with Stacey and Matt. It's tough to say thank you for that. I think the volunteers have been kind of a linchpin, really, of what we do over at the ministry. Like, we couldn't do it without them. We have a staff of about 50, and that can range between 50 and 57 with our transitional employment. But I think some of the unsung heroes, like Stacey, we have a medical clinic, not to the caliber of Stacey, of course, and her team and what they do. But we have doctors that volunteer, nurses that volunteer, an orthodontist that volunteers, an optometrist that volunteers. And then I think of some of our really steadfast volunteers like Dan and Mr. Jimmy. Mr. Jimmy just retired maybe 3 times. He retired with us. He volunteered with us for 14 years, and he's over 80. And he would be at the ministry for about 3 days a week. And that's doing small things, wrenching, screwdriver, painting, small repairs. Ralph, our director of facilities and project management, would put them on different projects, and they were always there. You would almost think they were part of the staff. That's how often they would be over at the ministry. So I think those are our unsung heroes, the folks that are there on a daily basis, along with the schools and foundations and organizations that come over to volunteer at Carriage Town. I think our database is about 800 people for volunteers.
Wow.
Right now.
Yeah, that's
but
amazing.
We definitely could use more. That sounds like a lot, but just
No, we already said the myth
Yes.
is that you don't need any more help.
That's right. We did.
So yeah, we were dispelling that. We're done with that. You all, understand this a little bit. We all understand people who live in the area. We have people who visit us from maybe family or friends come to visit, and they've only heard the national news about Flint. Okay, so their assumptions going into their visit are, it's really bad. It's terrible. It's Flint is not in the ascendancy. It is going down. We all, I think, our work downtown puts a slightly different spin on it. We see the struggles, but we also see the way there's great hope for what's going on in Flint. So I want you to talk to me about the balance there between knowing the struggle of residents and our community, but also seeing those stories that tell you a different story, that it's not all what you hear in the news.
I can start if you guys
Yeah.
like. Okay, I think Flint, so I'm a new transplant to Flint myself. I think Flint's a beautiful place, and the outlining cities and counties, because from what I can see, Flint's in the middle of a renaissance. I don't know if some folks are jaded and you've been here for a while and maybe you can't see it if you live in the place. But for me, being transplanted from Wayne County to Genesee County, I can clearly see that Flint is in a renaissance. It's on an upward take for sure. And sometimes I'm taken aback by people who ask me questions like that. Hey,
Yeah.
and they still ask questions about the water and some of the things that people see on TV. And it's tough when you, the only thing you know about a place is what you see and hear on TV, because that's not the full of the story, which makes it challenging. Sometimes it can be a little bit irritating. I say you should come. You should come
see it. That's
yeah,
good.
you should
Yeah.
come see. Flint's
Yeah.
a great place. You know what I
Yeah.
mean? And I think it's a testament to the people here. That's the one thing that I've learned by moving up here to Genesee County, that the people are great. It's family oriented. Tons of Christians around, and we tend to, and I say we because I live here now. So we tend to, if there's a problem, we all tend to come together in whatever ways we can, wherever our expertise is, to deal with a problem. So I don't see anything as being insurmountable. So that's one thing that I'm learning by living here, is that, collaboration, partnership, trusting each other, not being so focused on the issue, but how do we handle it? How do we solve it? And I see that every day here in Flint and Genesee County. So I'm appreciative of it. So I don't know what others see, but that's definitely what I see.
That's great to hear, Chris. It makes me feel good. And you don't know what you have till you're gone, too.
Yeah.
So I went to Ann Arbor for a couple years to work in Ann Arbor at the School of Nursing, and I could not wait to get back to Flint. It's just something else. We're just so united. We don't work in silos. We're a big family in Flint, and that's one thing that I like to take even a step further, and I'm sure you do the same thing with your volunteers and your professionals too, especially with the young residents. I want to tell them that Flint is unique to other areas, because I've been to other areas, and try and get those residents to think about staying here, continue the work that they're doing. And we have patients that end up getting back on their feet and provide, they pay it forward. They'll come back to the clinic. I had one gentleman, we helped get on the right path with his medications and he came and provided free exterminating services. So they're just joining our family of givers and giving back to the community. So
Yeah.
I was thinking about what Stacey mentioned when I was working in Samaritas' previous organization. My supervisor would often joke and make fun of me because they would ask me a question about, hey, they were opening the office in Flint. It was new expansion. They would ask me questions about different resources, and I would always be like, well, I know somebody who does this, and I know somebody who's that. And they would just, whenever I'd say that, they would laugh. They're like, of course you know somebody who does this, right? And it was like, and they had this idea of Flint. And it was kind of a joke about Flint because the organization is mostly in Metro Detroit. And whenever they would see how we all worked together and knew each other and could just say, oh, well, my neighbor does this, and they were totally amazed at the interconnectedness of the community, which I think is a beautiful strength of the community. That is, I think, a little biased, a little jaded, or not, jaded is the wrong word, a little biased, but I truly do believe it is a unique thing about Flint. And probably in some ways maybe the product of the struggle of the community over time.
Yeah.
The way that it's woven itself together, which I think is a really beautiful thing. Yeah.
I think the more that we can encourage, I think one of the, and I'll too, also point to Lisa in the back and say, I think her work here in our community ministries office pushes us into your network, right? Like churches can be siloed pretty much from one another, or can try to do ministries on their own, and they just kind of stay pretty isolated. But once you press into the social, the safety net that's out there, and you're partnered with organizations like your organizations, I think you have that feeling of we're not just like isolated, but like we're connected through you to a vast network of people doing amazing work in the city, and that's exciting for us, at least. For me, I can't speak for all the congregation, but I'll speak for me and say it's really exciting to be like, oh yeah, we're part of this tapestry of service. We're not just trying to do it all on our own. Okay, tell me. Let me pick on each of you a little bit individually here. So let me start with. I'll start with Stacey. Sorry, Stacey.
It's okay.
One of your commitments is providing dignified care for your patients. I can imagine that is challenging at times, given maybe some of the needs that are presented by certain patients. Tell me why it's still important that you are working and striving towards providing dignified care, and not just a outpatient, quick, pop in, cold calloused, get it done, write the script, get out of here.
Oh boy, just to see that dignified care to me is seeing that personal growth in a person, and letting them know that they're a child of God and they are loved by God. I can't actually, minister in that way, but we minister the love of God by listening to the patient, loving them where they're at. They might come in hostile or had been mistreated in another primary care facility or something like that, but if they're angry, we're going to dig deeper. We're going to listen to them. Our patients are in our office a long time, and sometimes they're happy about it and sometimes they're not, but we're going to get to the root. Some of them may be angry that they can't get transportation to our office, and they come resentful that they had to get a ride in there. And there are other ancillary social determinants of health that they bring into the clinic. So to be that place where they can let us know what's impeding in their overall health, and seeing them grow, and then just share automatically, and be able to say, okay, I listened to you, Doc, and I tried this medicine. It still made me sick. And the doctor says, well, I'm glad you told me that. Let's try something else. I'm glad you feel comfortable in sharing. And the fact that they'll be compliant and yes, you were right, So just creating that relationship, that respect and listening. I don't know if that answers your question, but to me, that's dignity.
No, it's beauty. I mean, it's beautiful.
Yeah.
It's if we were putting the Christian spin on it, right? I mean, Jesus said, when I was sick, right, you took care of me.
Yes.
And like that, and that the revelation that you're taking care of Christ is the mandate for dignified care. I find that beautiful. That's wonderful. Okay, let me go to Matt. Matt, when somebody is without transportation, when they don't have access to that, or they have a car that is consistently breaking down and not reliable, how does that set off, like what chain reaction does that set off in them that could cause them to spiral?
Yeah, you see often the lack of access to be able to get to a grocery store, not just because you can't find a grocery store on the bus route, but something I've taken for granted my whole life as someone who's had the privilege of being in a family or having a car is I can just take my groceries and go put them in the car. In fact, I can just call Aldi's and put in an online order, and they put it in my car for me if I want, which I still feel weird about. I always make sure to help them because it's just my own personal kind of thing. But, family...
you get out and help them load it into your car?
Yeah, because I just, it's just
you can't
it's
do
a
it.
weird
You can't
vibe.
do it. Yeah.
But the point of that being, you're always able to put as much as you need in your car.
Yeah.
But if you're taking it by bus, unless you have a wagon or some ability to carry, how would you be able to carry all those groceries if you have a family of 3 or 4 kids?
Mm-hmm.
How are you able to physically, often, maybe even a single parent household or dealing with a health issue or elderly person, like how do you even begin to do that? So that's just one, kind of example, but I think, employment, obviously, it becomes a huge piece of the puzzle when your car breaks down that morning. And I think often, because there's so much instability in many of the family's lives already, employers see it all the time, and sometimes they're understanding and other times they're not. And you might have a really legitimate situation where you've been a good employee, but you're there your first week, or it's your interview, and your car just doesn't work that day, and you have no way, you don't have anyone else that can take you there last minute in that moment, and you miss that opportunity, you lose that job. And that can become it can be just that next domino that can emotionally, psychologically kind of beat on you to the point that you, other parts of your life might begin to fall apart a little bit.
Yeah. No, I mean, you can keep going too. I mean, whether it's getting to and from medical appointments, whether it's getting to, you got to get to the hospital without, whatever it is, there's just like, it seems like something that we take for granted, we who have dependable vehicles that work when we need them to.
I remember I had a client young person last year who ended up having, kind of an emergency heart situation. You maybe even remember it, maybe, but I think they ended up eventually coming in and getting checked out there at the clinic. But thankfully, one of the neighbors in the building there had a car and could take them. But this was a newcomer to the United States, didn't really know anyone else in the community other than fellow refugees who were living in the building there. And one family at that point had a car, and it happened in the middle of the night. And I didn't see any calls. I mean, it was like 2-3 in the morning. Yeah. And needed emergency to get to the hospital. We go over how to get to the hospital, like, this is 911, this is what you do. But when you're only been in a new place for 2 or 3 weeks, it's, I mean, everything's different. Right. And so it's, thankfully, what is that person going to do in that situation other than hopefully find somebody that has a car, get a hold of someone that can help. But it's, we take so much for granted that folks, I can't even begin to understand myself personally how I'd navigate those situations when they come. Yeah,
for sure. Thanks. Okay, Chris, one of the struggles you have at Carriage Town is you have people who need their short-term needs that they might find their way to you for. You have long-term goals for them, right? So how do you balance the resources, energy, time when you try to figure out we need to get this person to bed, but we also need to help this person be job ready, right? So you have a short term and a long term goal. How do you balance that well at Carriage Town?
That's a great question, and I think I like to think we balance it well, but as we talked about earlier, sometimes you can't measure yourself by yourself. If you ask the right person, the response could be different, but I think we're doing it well. I think part of the reason that we are able to is firstly because of the Christ component to our programs. I think that's can't be understated.
Mm-hmm.
And then the other part is, yes, we want people to be connected to church. We want people to have a relationship with God. We want them to accept Christ, but then we want to be practical too. We want to make sense, just like Matthew 25 says. I was hungry, you fed me.
Yeah.
I needed clothes, you clothed me. So I think because we have such a good network of volunteers, folks that donate and partner with us, we're able to do those things really well. I think one of the things that my predecessor, Dr. Dallas Gatlin, in his 14-year tenure, if you drive by the campus, it's very clean. Most times people don't know that we are partially a homeless shelter. We're a community-based organization, but most folks who drive by, you couldn't tell. And so a lot of times we will get that from the folks who come and monitor our programs, and then sometimes from our residents. We will hear that, like, hey, this place is really clean. I'm not used to this in the shelter environment. So if we can, in relationship to Maslow's hierarchy of needs, if we can take that survival mode out by providing a bed, so a decent meal to eat, and they know that they're safe and warm. And it usually takes maybe a week or two for someone to settle in to say, hey, okay, I'm here, and now I don't have to worry about how I'm going to get around maybe to the store to get food,
right,
or how I'm going to get to the doctor, social determinants of health, transportation, homelessness, all of what we're talking about are cross sections into a community issue that we have. So I think the biggest thing that we can do to try to continue to do those things well is seeing what we do well, assessing kind of where our programs are at, where our people are, where our staff is, what do we need to maintain. And some of the things that we've been able to, I think, maintain over the 75-year history is the way that we treat people.
Yeah.
We treat people with the love of God. So that makes it easy, and I mean that in a relative way, because it's not easy, but I think because we have the love of God, we have really good partners. Most of our staff are really involved in taking care of our residents and in the programming. So whether it's you have a job in maintenance, or if you're a case manager, an intake worker, myself, some of our directors, we're all involved in trying to take care of the clients, and we have interactions with them. So I think the team is what really makes it possible for us to do what we do on a daily basis. And so anytime I have an opportunity, I say I have a great staff, the people who love God, but they also love people. And so that makes it easy to come in and you have 50 people that really love and care about people. And so they will go out of their way. And yes, we're getting paid for it, but it's different. I think I have, it's been a blessing for me to work for 3 Christian agencies now to get paid to work for God. Like, that's awesome. You know what I mean? It's really awesome. But our staff, they get paid, but they really have a heart for it. And so I think that is really the component that kind of makes it, again, relatively easy for us to do what we do.
I like it. Okay, the last question I want to ask you, and then we'll turn it to the floor for a couple open questions if people have them. So be thinking about your questions here. But if you could, by virtue of a generous donation or a catastrophic positive event, fix your major bottleneck, what would that bottleneck be, Matt?
Yeah. Over the last couple of years, we've been able to expand from pretty grassroots type organization where we were servicing around 100 people a week, or 100 people a year, with part-time kind of volunteers mostly. We've been able to expand to having that full-time mechanic, which has tripled our output as far as the amount of families we're able to serve. We still have a second bay, and we just were able to buy a second lift so we can utilize that second bay better. But the ability to have another mechanic that was there full-time on a day-in, day-out operation would, allow us to partner with even more organizations in the community that we're a little bit, honestly, like intimidated to open the floodgates with, because the need is so overwhelming.
Yeah.
That we would just get. We don't want to have a backlog where we're taking a client in and then we'll get to your car in 2 months or 3 months. We just can't have that.
Yeah.
So the ability to service more families and to maximize the facility we have, maximize those partnerships would be kind of there could be 20 garages like ours in Flint, and I don't think you would touch the need that's there, to be honest.
Yeah.
Because we're so limited even in our partnerships. Like,
Yeah.
we're not even talking about like DHS or like, some of the huge pillar partners that could send us, 50 families to work with a week.
Right.
Yeah.
Okay. So opening up a second bay, more mechanics.
Another being able to,
All right. Stacy, what's the bottleneck at the clinic, and if you could fix it like that, what would you fix?
Number one.
Yes.
More staff.
Yeah.
Sometimes.
Paid staff.
Yes, paid staff. That would just a nurse practitioner to be able to open one more day a week would be great. Service more sick patients and that, and then going down the line, a bigger office, 1 or 2 more exams room, and a bigger parking lot. So those are just a few bottlenecks.
Yeah. Thank
But
you.
We just take one day at a time,
Sure.
and
Yep.
and this great community, it'll happen
Yeah.
eventually.
Bottlenecks at Carriage Town.
Staff, bed capacity, housing, those 3, and not necessarily in that order.
Housing at Carriage Town or housing in the city?
Both.
Housing
So-
in the city,
So we
yeah.
definitely, I would say permanent housing in the city, so that's
Yeah.
apartments. I think there's
Amen.
last year there was like a 7,000 unit shortage. We're only building 100 to 200 units a year, so it's going to take a long time, and that's throughout Michigan as well. In Genesee County, I think it's 7,000. So having a place for people to go. So once they leave Shelter of Flint, Carriage Town Ministries, My Brother's Keeper, YWCA, Reach, all the places that deal with the homeless population. What our folks are finding is they're having a hard time finding a safe, affordable place, and so that would be one. We have a bed capacity issue. Our waiting list right now. It's more than what I'm about to say, but I can say safely that if we were to deduplicate all of the people on our waiting list, we have about 500 people waiting to get into shelter. So that's men, women, children, families.
Yeah.
I think it's actually probably more than that, but I can safely say 500. So, but then all of the shelters are at capacity. So over the last maybe 3 or 4 years, what would normally happen is the shelters would empty out a little bit over the summer. You'd see a decrease in utilization, but it has not been that way over the past 2 or 3 years. We are pretty much at capacity or near capacity all year round now, and that's just not our agency as well. So I would say more beds, emergency shelter beds, more beds for homeless services, and then more permanent housing beds, so apartments, houses, things of that sort, definitely. And then staff would be for that individualized care. If we have more staff, more case managers, then our folks can get more of that individualized care. So I'd say those 3.
Okay. We know how to pray for your organizations. Absolutely. From you all, questions that you have for these organizations? Yes.
Matthew, you talked about the bus system. Well, one of the things that's increased are the number of bicycles. So is there a way, there used to be a lady at the market, but I haven't seen her in a while. Do you know, like if I sent them to you, would you have a way to refer, or is there somebody that you know is fixing them?
Fixing the bicycles.
Yes.
Yeah,
both the motorized and the regular.
I
So
believe.
sorry, let me just restate the question just for the sake of the recording. The question is there anyone here who is doing work fixing bicycles
There used to be.
because of the increased number of bicycles being used instead of maybe other transportation? Okay.
Yeah, I know maybe Ryan or somebody else, Janie, multiple people in here might know the name of the organization. Recycle. Yeah, and I believe last time I checked, I think a couple months ago, I thought that they still were operating, but I don't know that they have the mobile set up as much. But I could be wrong, but I think last time I think they're still functioning. Is that? I don't think that. I think maybe out of a different facility, possibly. it was something on their social media that it was something was still in development. But yeah, I mean, I think it's especially for the warmer months, a huge solution, right, for a lot of families, and being able, that gets to how we plan our cities, and being able to have bike lanes and things that allow people to, like, a lot of times newcomers come to the United States. The first thing they're going to have, they might not have never driven a car before. They don't have a driver's license. They got to work, and they can ride a bike.
Yeah.
So I think it's a great thing that could be invested in more in our community. Yeah.
Yeah.
Where is this recycled? I didn't catch the name of-
Are you Googling them right now, Ryan?
Well, yeah, but so they had a kid, so I think that kind of slowed them down for a little bit. But but if they popped up again, I don't.
Her name is Cassie Mason.
They live in Carriage Town,
Okay.
but yeah,
Thank you.
Yeah.
they're around. I don't think the mobile thing is out
Right.
now.
Okay. Thank you. Other questions? Yes, Jack.
Matt, do you have any supported relationships with the automobile dealers in the county?
Mm-hmm. We have had some conversations a little bit here and there. We have some relationships with shops, other shops, who sometimes will send us a family or refer to us, do like an inspection, that kind of thing. I would say as far as like a corporate relationship, probably the strongest one we have is with O'Reilly's. They're actually right across the street from our shop, and we source a lot of our parts through them. They give us a really nice discount for the families. So when the families come in, not only are they just paying the cost of the parts, but they're also getting a discounted part generally. And if we can get the parts cheaper, if they maybe can wait a few days, sometimes we can order it online. We can save them an extra $50-$60 sometimes, even that way. But we've explored and had some ideas of some conversations with them. We'd still try to figure out exactly what, like, outside of like a financial support, what that relationship could look like. But it's something we've thought of, but haven't really developed yet, so to speak. Yeah. Mm-hmm.
Other questions?
I have a question.
Yes, mother. It's my mom.
Several of you have mentioned about being on a referral list. If you know someone, how would I direct them to this referral list if they need help?
Are you speaking about for volunteers or for potential
I'm thinking of people who could use
services?
all the services.
Okay, so if individuals know somebody who could benefit from your services, what's the best way they could help get them referred? I think most of you have partner referrals.
Yeah, I would say find help. 211 is where we find a lot of people being sent to us from 211 in addition to all of our partnerships here.
Do you know that 211?
No, I don't.
If you dial 211, you get into a switchboard of kind of resources that are out there that can connect you to different things. A person could get connected there. Make sure they're being served by the different things that could potentially be available to them. But
Thank you, Pastor.
Oh,
Yeah,
sure.
That's right.
So yeah.
Just call over to the ministry, I think, would be the best way, just because of the waiting list. Sometimes vacancies will open up unexpectedly. It just really depends on what's happening. I think that's the best way to call. We have some people who show up at the front door, and then we'll put them on the waiting list. If there's an opportunity at that time, we'll try to address it with that individual or family. But the best thing to do is to call over to the ministry.
People connected to this church could certainly make a referral or talk to Lisa, and Lisa, our community ministries office, could make that referral on that person's behalf as well. That's one way, and she could help do a little initial vetting. That's part of what Matt I think was talking about, is like the trust that is established is at the partner level. So when Lisa sits down with someone, she's able to really figure out what their needs actually are, and not necessarily what they present, but then able to make that referral. And then the partner organizations have such good relationships with us and Lisa that they would say, oh, we trust them to know that this is the right person to send over. So it's not just, yeah. Dick.
Chris,
Yes, sir.
what might be the average stay that somebody When you go to Carriage Town, is there a limit to how long you can be there?
Average stay at Carriage Town.
So the average right now, this is one of the data points that we actually get measured on, is a length of stay, recidivism, and positive exit destination. So recidivism is the number of people leaving Carriage Town and coming back to us homeless. Length of stay is just like it sounds. And for the last, the time period that we have data for is third quarter of last year, it was 140 days was the average length of stay. So that's 4 to 5 months, which is a long time. And so that then contributes to the bed capacity issue as well, because people aren't exiting shelter as quickly as possible. And so if they were to get what we would call a homeless choice voucher, which is Section 8 for folks who are homeless, that could take 6 months to a year, could. And then if you, there's an assessment that's done at the beginning of intake, then there's a waiting list, QBNL, quality by name list. But it's almost like a lottery, so to speak, because even if you get on the list, there's no guarantee that you're going to get pulled for that service. So more than likely, right now, what we're seeing, the fastest way to end your own homelessness, which is what we would prefer people to do, is to get a job, save some money, just like all of us would do. We save our money, we get a place. If we need help, we'll ask for help. But that's the best way. But right now, it's about 140 days. However, there's been a big change with temporary assistance for needy families, which is TANF, which is federal dollars. And some of the changes that have come from the federal level is that now we can only use this pot of grant funding, TANF dollars, for 120 days. And so now we have to figure out, okay, after 120 days, they're saying, hey, we're not asking you to exit the person from shelter. We're asking you to find another way to pay for it. But 120 days is all the families would get. So there's several things happening, a lot of back and forth with the federal government right now. And we need to kind of see how things settle out with SNAPs, with the TANF program, and some others that may affect how long we keep people. But we're trying to do our best and just make sure that there has to be a fine line between keeping a person long enough and not too long. You know what I mean? A year, really, to be honest, is too long. That means some of that onus is on us. We want to try to move people out a little bit faster so we can help other folks. It has to be a little bit of both.
Yeah.
Some responsibility for the individual, and then some responsibility on our end to make sure that we are delivering the programming in a way that's moving people along fast enough.
Yeah, I need to officially bring us to a close just because we're past 7. But if you have a question, come up and bug them afterwards. All right. I'm sure they wouldn't mind answering a few of your questions as well. So could we please collectively thank our guests tonight for being here? We appreciate it so much. Thank you. It's a joy to be in partnership with you all. And I pray. Let me just do a prayer of blessing for you and your organizations. Merciful God, we ask your Spirit to rest upon Forged Flint, on Genesee County Free Medical Clinic, on Carriage Town Ministries. We pray that there would be enough, whatever that means, enough help, enough support, enough money, enough resources, enough volunteers. We pray that in the shared work that they do, they would be in communion and partnership with your Son, our Lord Jesus Christ, who walks these streets, who sleeps under these bridges, who spends the night waiting for someone to help. Lord, help us be those people. Through Christ, we pray these things. And all God's people said, amen.
Amen.
Thank you all.
Thank you.
Thank you
Thank
so
you, guys.
much. Yeah.
Thank
Thank
you.
you.